Hi, I'm Becky DPT, and today I would like to discuss blood clots, also called a DVT or a deep vein thrombosis. A very common location for a DVT or blood clot to happen is in that calf. A lot of the symptoms that show are redness. Sometimes you get swelling in the leg or down into the ankle below where that blood clot is because the circulation isn't moving properly. That redness, it'll be warm to the touch, and it'll also be painful if you dorsiflex. So if you pull your toe back to you, it will be very painful in that calf. I send my patients to the emergency room so they can be evaluated and have a Doppler ultrasound done. A blood clot is very treatable, but it is very important that you get evaluated promptly. If you have a blood clot, that blood clot can move. That's why it's very important to try not to put too much pressure on that leg if you're trying to get out to the car, because you don't want it to move and travel to your heart or travel to your brain, travel to the lungs. It is something that you do not want to leave and postpone to be treated. It is something that you need to have treated very quickly. It can happen on a trip, if you are traveling by plane or driving in the car. It can also happen if you have had an injury to a vein or if you've just had a surgery. Hopefully, this discussion today helps give you a little bit of information. If you feel there is a possibility that you have a blood clot, get very prompt medical evaluation. Have a great day.